decisions.
And again, people are crazy and they think robots will dominate the world.
It's true, they might, and you never know.
No, they
Okay,
won't.
let's see. What do you guys? Let's look at some of these engaged questions on here. It says, "What's the biggest challenge for healthcare workers when using personal protective equipment?" What do you
They
think?
might forget, or
Forgetting?
it might have a hole in the glove, and they just do, oh, it's alright.
Maybe the glove is messed up, or the what else?
They're not careful.
Might not be careful.
Because you think you're already safe.
They're using defective equipment.
Defective. That's a good word for it.
I remember I was at work and they had this humongous acid spill in the auto area, and the managers were the ones that were in charge of fixing it because no one else could.
Mm-hmm.
And they put on all these protective equipment. They looked like they were in green suits and stuff. It was ridiculous. But anyway, one of them, their issues was they never had to do it before. They had just learned it during the training for the managers, and they didn't know how to move around in them. And one of them actually almost got hurt because they almost fell on top of it, and the protective equipment wasn't meant for it because it was still awesome. The little thing where the osmosis thing comes in, and that liquid that was on the floor was capable of that. And so if you'd fallen on it, it would have been bad. And then I didn't even get why they wore the suit, because if it's gonna be like that, why wear a suit? So.
When I think of the biggest challenge as far as putting on protective equipment, I think of time, because it takes time, right, to put on a gown and gloves and a mask or whatever. And if you've got 5 patients you're trying to take care of and you're running around like crazy, you know, you're not going to want to take the time to put that gown and the gloves and the mask on every time you go in that patient's room. You see what I'm saying? So I think that's, to me, having been in nursing, having seen all of this, that's, to me, is the biggest drawback, is that it just takes time. So it's like whenever you go into that patient's room, you want to have, like, let's say the patient had a medicine due at 8 and at 9. Well, I'm probably going to go in at 8:30 and give both, because that's still within my time limit for my 8 o'clock, and it's in my time limit for my 9. I'm going to go in there as less, the least amount of times I have to, because it takes so much time to get all my stuff on. You know what I'm saying?
Aren't those people, I'm not trying to be mean, this is probably off of TV, but anyway, when they have those diseases, don't they, separate? They have a room, and then there's a room that you enter before you go in that room?
That's like a communicable disease. You're talking about, when the CDC comes in, they have on their white suits and stuff.
No, I'm thinking, they have a room, and it's kind of like that, except they've only put on protective equipment, and they do it so if they walk out, all their little issues only goes in that outer room. You open a door, and then you see class, and the rest of it's like a normal room, and then you go through that door.
Oh, well, not necessarily. Now, usually with things like, let's say somebody has MRSA or something like that, where they are under precautions, they may be in a regular room, but it'll have a sign on the outside of their door, and it'll say contact precautions, and it'll have a set of gowns and gloves there outside, so you put it on as you go in. But you don't want to wear that gown into the next patient's room, you know what I'm saying? Because then you're taking it with you. So that's why you want to plan very well, is what you need. And it says, do you think the PPE provides the proper protection for healthcare workers? So do you think PPE is enough?
No, or else we wouldn't have the guys with the white suits.
I'm not necessarily talking about smallpox or something like that. I'm just talking about irregular diseases. Now that's going to be a whole different ballgame.
Yeah, as long as you wear your gloves and your mask and the stuff you need to wear.
It should, right?
Yeah.
And you wash
still
your
gotta use your
hands,
brain.
and you Germ-X the whole place.
I feel like if you don't want to do it, that's your choice. So if you get something, that's on you.
Yeah, but what if you give it to the next patient? That wasn't their choice.
Then that was your fault.
Right.
Well, it's more of your choice if you get it, if you have the choice to go in there. It would be the patient's fault if you weren't smart enough to not.
No, I agree. It's not theirs, but it's not the next patient's fault either if you get the next one sick, next door. Okay, what type of PPE do you think is used most frequently by healthcare workers?
Gloves.
Gloves, I would definitely say gloves, for sure.
at the dentist we all had to wear masks.
Yeah.
Them things get hot.
Oh, and your breath
And
stinks.
it's hard to breathe.
Like,
too.
you brush your teeth, but your breath still stinks. And I'm just like, oh my god, I need some gum.
It's like hard to breathe in those things.
It is. You get used to
I was
it,
having
but
trouble.
it
I was
takes
like,
some time.
I'm gonna die.
Okay, what are the biggest mistakes that you think healthcare workers make when wearing PPE?
Not taking their gloves off properly and
Okay.
disposing of them.
Not taking their gloves off properly? How are you supposed to take them off? You remember?
Like,
I do it every day.
You do it like
Or-
this,
yeah,
and then you
like,
go in your hand, and then you
put the
go.
other one, you pinch it, and then you
Y'all are gonna
ball
be
it
so
up
ahead when you
together.
get to school.
What's sad is
Then
I
you
do
throw
that
it
at work and I get
in.
picked on for it. Like I'll take them off and I'll hold it and I'll put it in and I'll take off the other one and people are like, why do you do it like that? I said, my teacher made me get stuck on it.
I know, it's just like a habit now.
Okay, let's look at this next. It says standard precautions, equipment and methods that prevent the transmission of microorganisms from one person to another. Okay, safety. Remember, we've already talked about safety. Safety is, number one typically when you're doing whatever you're doing at work or working in the healthcare field, and this fits into that. Okay, because you're worried about the safety of everybody around you and yourself. So standard precautions, these were established early in the AIDS epidemics. We're talking 80s. Okay? Prior to the diagnosis of AIDS, personal protective equipment was used only in identified infectious processes. So people only used personal protective equipment before we found out about AIDS if they already knew that somebody had an infectious disease. So you're talking smallpox or tuberculosis or hepatitis B potentially, but
So if you had a disease,
measles, mumps, those kind of things.
like if the patient had an infection or disease and you didn't know about it, you didn't wear gloves, and then you'll end up getting it.
Okay, I have a question about the smallpox thing. Was it used to be normal? Because when I looked at rare diseases, it was like number 10 of the most rarest thingies. And I remember when I was little, every cartoon at some point they had chickenpox. Like on what was that one?
Well, chickenpox
Arthur.
and smallpox, though, are two very different things.
They are.
Yes.
I thought they were the same, just different things.
No, they're different, very, very different things. They both cause pox. They're just called pox because of the things that they put on your skin. But they're very different. Y'all remember from last year? I just taught this in my other class a few weeks ago. Y'all remember how the smallpox vaccine was found?
Yes, I do, from cows.
Cows.
That was the greatest video ever.
Remember he took the pus from the cowpox and injected it into the little boy.
Yeah.
That was so gross.
Anyway. Okay, it says prior to the diagnosis of AIDS, personal protective equipment was used only in identified infectious processes. Once AIDS was better understood, personal protective equipment was universally applied to all patients. So once they understood that you can get this disease just from, if your hands touch their blood or bloodborne, they said, okay, we might need to be more careful. There could be other diseases out there we don't know about. And now we're like, everybody wears gloves for everything. So. These are applied to all patients or residents at all times because not all diseases are readily observable. So we don't always know. I mean, AIDS, for example, sometimes there's very few symptoms until the very late stages. People don't even know until they start getting really sick. So, but that could still be, people can still get it. The gloves should be worn at all times. Now, I don't necessarily think that you have to wear gloves at all times, and it always says this, and I have to say this every year, but I'm going to stick with what they put down because curriculum. But hands should be washed, it says, for a minimum of 10 seconds, but y'all know I say 15, that's me. And gloves change when moving from one patient to another. Now, if I'm just going in and I'm going to take some vital signs on someone, I'm not going to put on my gloves unless I know that I'm going to give them a shot, or if I know that they are really, let's say their arm is bloody or something, okay, then yes.
Could you check their pulse with gloves on? I was wondering.
You can, yeah. definitely
So
could. But I don't usually, unless they have something that I know that they're under contact precautions, so I know that I need to be wearing gloves. I don't wear gloves for things like that. Now I'll put them on, obviously, if I'm gonna draw blood or have any kind of access to any kind of bodily fluid, but other than that, I don't just wear them for a normal exam. I just make sure I wash my hands before and after. Just for one, I think it seems impersonal, you know? If somebody comes in and just wears gloves the whole time they're talking to me, I think that's weird.
I don't know, because I went in with a rash before, and the lady touched me, and I would not have done that.
Yeah, now rash, I'd probably put on gloves if I'm gonna.
She touched you with that gloves on?
No, without her gloves on, but she like washed my hands like right after that. So like,
This whole
Yeah.
time she touched
I didn't know
you
what
with
And
that
I mean,
rash
like,
is.
I've even seen, I've even looked, and I probably touched the guy while we were doing assessments, but a guy who had leprosy, you know, that's very contagious, and I just washed my hands after. Of course, that was in Ethiopia. I would never do that here. We shouldn't have gloves there, so, or we did, but they were like, we would like use them and then wash them and reuse them, so.
I still
that's
think
all we
you're
had.
brave to do that. I would not have done that.
But like I said, so as far as if whatever questions you have, yes, you should wear them all the time. But in all actuality, I'm not going to wear gloves with every single person. But anytime there is any opportunity for me to, you know, to touch any body fluids, yes. Or if they have a rash, that would be another reason. Yes, I definitely want to wear gloves. It says, depending on the activity performed on the patient, the nature of the patient's illness, and the amount of exposure to blood and body fluids, other protective equipment should be worn. So your gown, goggles, etc. So if I'm doing wound care on someone and I'm going to be washing it, you know, if I'm going to spray it or something like that, I'm going to wear goggles for something like that because I don't want it to spray into my eyes. Needles should never be capped. And you will see people do this all the time.
what do you mean?
Okay? So you get your needle. Okay, once you pull this off, you're not ever supposed to put the cap back on. Once I've given them their shot. Now, if you haven't given them their shot yet, whatever. But let's say I give them their shot. What's wrong with me doing this?
Somebody might be
it
using
might
it.
miss.
Yeah, I might miss. What if somebody bumps my arm and I poke myself in the finger? Okay, and it's already injected into someone else. Okay, then there's a whole lot of paperwork that has to be done. There's a whole big, long process. They're going to have to draw blood, make sure, you know, it's just a big nightmare. And you'll see lots of nurses put the cap down and do it like this and recap it that way.
Why don't they just throw it away?
But it's still not safe. Yeah, you're supposed to, as soon as you get done with it, just throw it into the sharps container. It always has to go in a sharps container, though. Y'all know that, but, you know, you don't just put it in the trash can. You don't want whoever gets the trash to get poked by it either. But you'll see people who will take it and they'll just stab it into the,
Patient.
no, like the cushion or something, like the table or the bed. Sometimes they'll just stick them in, which just really grosses me out. But anyway, so yeah, none of that. As soon as you're done, just put it in the sharps container right then. And that's the safest thing to do. Because you don't, you know, if I'm trying to recap it, or maybe I cap it, you know, try to cap it this way and then it falls off, I don't get it on good or whatever. It's just not a safe practice, so don't ever recap needles. Now sometimes, let's say I go to the pharmacy, I draw up my medicine, and then I have to go back to the patient's room. Well, yes, okay, that's the time you're probably going to recap it. But typically you're going to use a new needle anyways if you draw medicine. So it'll already have a cap on it whenever you twist it on. So you won't have to worry about taking it off or on. Yeah. All sharps, needles, razors, etc. should be disposed of in a biohazard puncture-proof sharps container like ours that we have back there. It should be a hard plastic. Sometimes if I have patients who have insulin at home, like when I was doing home health, I'd always keep like my dishwashing soap bottles. You know what I'm talking about? They're like a really hard plastic, and then I would take those to their house and we'd just put their needles in that instead of buying a sharps container, you know, something like that was a hard plastic that the needles aren't going to go through. Coke bottle's not really quite enough, but. Okay, it says never carry needles or sharps from one location to another if necessary. Never point toward another person. Don't carry it like this. Don't carry it like this. Point it down. Or, I don't really like pointing it like this, because what if I fall? I always just point mine down, so anytime I hold it. I know y'all think I'm crazy, and I'm like, no, that's going to never happen, but you just never know. Crazy things happen. I mean, y'all saw the Prevent It videos, right? Remember? Slipping with the boiling water, or falling off of the, she's like, I should have never used that ladder. Where she fell off the ladder. Okay, all unknown spills or waste should be treated as potentially hazardous. Always. We learned that when we talked about spills. Okay, types of PPE. So gloves, obviously we know about gloves now. A couple different types of gloves. Usually you've got latex gloves, which are usually the white ones. Sometimes they have powder in them, sometimes they don't. And then we've got like nitrile gloves is usually what people will use. And most places these days use the nitrile gloves, or sometimes they'll have vinyl ones, but and that's because there's so many people that are allergic to latex. Tons of people are allergic to latex. They don't want to use those unless, that's all you've got, and you know that they're not allergic. Okay, another type of PPE is a mask. So could be like the masks you guys used at the dentist, right? You definitely, and they use the ones with the shield.
No, it was just like the facing.
What about the dentist who is actually, they did give you goggles. Yeah. Okay, good.
But I didn't have to have goggles.
So you aren't all the way up in there. Okay. Well, and that's, because they're, getting sprayed is probably going to happen with what they're doing. They're spraying water, they're drilling, they're, yeah. Grosses me out. But remember, there's different kinds. So you have those N95 masks. Remember the big ones that I pulled out last year for the TB? They're a lot stronger, a lot less through. So, okay, respirator, like we just said, that's the N95 that I showed y'all last year, the little round one. Goggles, obviously protect your eyes. Face shields, y'all know what those are? Remember the mask, and it's got the plastic at the top?
Mm-hmm.
I remember those. I'll pull them out in a minute. Of course, gowns, and then a cap protects your head. I think caps are also used to, keep your hair from getting everywhere else too, but anyway. Okay, uses for PPE. So gloves, obviously any bodily fluid, secretions, excretions, contaminated items for touching mucous membrane. So anytime you're going to have your hands in somebody's mouth, if you're going to be putting in a catheter, if you're going to be, doing any kind of respiratory suctioning or anything like that, you'd want to use gloves. That's for your mucous membranes. And of course, non-intact skin. So if you're doing wound care, something along those lines. Okay, gowns used during procedures and patient care activities when contact of clothing or exposed skin. You might come in contact with blood or body fluid. So any kind of surgery, a lot of times in traumas, they're going to use those because, they'll might get stuff on your clothes. Anybody who's under contact precautions. So let's say I've got somebody who's got MRSA and I go in and give them their bed bath. Okay, a bed bath, it's pretty likely probably some other part of my body may touch them at some point because you're kind of getting up close and personal, right? So that's another time you want to wear a gown. Mask and goggles or a face shield. Use these during patient care activities likely to generate splashes or sprays of blood, like we said with wound care or like at the dentist office. Okay, transmission-based precautions. We've talked about these before, so this will be kind of a review. Airborne. So these are diseases that are spread through the air. So just somebody breathes, somebody else breathes in what they've breathed out and acquires it that way. Examples include chickenpox, measles, and TB. I'm surprised they put chickenpox on there, but anyway, makes sense. Okay, droplet precautions. These are diseases actually spread by droplets. So I sneezed or I cough and droplets come out, somebody else breathes those droplets in. It's
Did you
kind
know?
of like airborne, but these are, droplet is a lot bigger. I mean, they have to cough or sneeze or something, actually.
Did you know? If you sneeze, your like stuff can go out to like 15 feet. That's awesome.
Disgusting.
Except if you're sick, that's gross.
Examples include certain types of meningitis. What is meningitis? No.
I've heard of it. Hold on.
Itis is,
Information.
you know where your meninges are?
The what?
Your meninges, do you know where those are?
Is it the fingers or the toes or something?
Meninges are the different layers of the lining, or not the lining, but the different layers around the brain. Well, yeah, like the lining around the brain. So, not good. Brain infection, basically. Pneumonia. Pertussis. What's pertussis? Do y'all know?
Isn't that the coughing disease?
Whooping
that
cough.
babies get?
Oh, you like that commercial?
Tdap. Tetanus, diphtheria, pertussis. You know that shot you get? Tdap. Probably got it in year 14. Influenza, which is flu, mumps, or German measles. Contact precautions are diseases spread by contact with infected skin or objects. And examples include herpes, impetigo, diphtheria, scabies. Do you know what scabies are? Body lice.
Oh yeah.
But
That's
sometimes-
when you don't wash, isn't it?
Not necessarily. Like, it could be.
Mhm.
But sometimes, like, okay, one example. My husband got scabies one time. I'm sure he would appreciate me telling this. But he was working at a camp, and he stayed at some dorms in a college in, like, Kentucky or Tennessee or somewhere, I don't remember. Anyways, well, that bed was infested with scabies, so he got them because they were on that bed. So,
Did he come home with them?
well, he took medicine and stuff.
Can't you get it from hay too?
I don't know.
Cause I got something. I forgot what it's called. They're a really big word. But I got something from hay.
Now, I saw lots of scabies when I was in Ethiopia because, and I think the biggest issue there was they just didn't bathe. So, but yeah. AIDS and MRSAs are other examples. So,
That's how people think you can get AIDS from just touching somebody.
well, it's still infected skin. I mean, it's still, for AIDS, there's supposed to be a break in the skin, you know. But with any of these, I mean, there's gonna, like impetigo, herpes, there has to be a break in the skin for it to be contacted.
When I was little, somebody told me that you can get AIDS by sitting on a tulsi.
I don't know, everybody always says that.
I
and
freaked
then
out.
That's not the case.
Yeah, I thought you could too, and I was like, I ain't ever seen on
No, me too.
Now, I've heard, I know that the curriculum says that TB is airborne, but I've heard that TB can be droplet as well. It's just they're like micro droplets.
Yeah, I
but-
thought like if you're in their face and they cough on you, you can-
Yeah. So, you know, but as far as precautions go, you use airborne precautions. Now, I may be wrong on the other, but anyway. Reverse or protective isolation. This concept is the opposite of all the others. It involves protecting the patient or resident from any infectious process. So instead of infecting everybody else in the hospital from this person who has measles or TB or whatever, you're trying to protect this person from everybody else in the hospital. It's reverse isolation. So let's say somebody comes in and they have leukemia, okay, and they come into the emergency room because they have fever and they're getting sick, okay? That's someone who needs to be in reverse isolation. Yeah, sorry, my brain went crazy for a minute. So, does that make sense? We're going to put them in an area where they're not going to be as likely to be infected by everything that everybody else has got because their immune system is already down. They already can't fight disease. Does that make sense? That's reverse isolation.
Isn't that just like putting them in a room though?
Putting them in a room or wearing a mask. So you guys have probably seen people who there may have been some other sign about them. Maybe they didn't have their hair or they looked really pale or something. You could tell that they were sick and they were wearing a mask. Okay, they were doing reverse isolation.
I always thought that they were just very, very badly contagious.
I mean, it could be that they are the ones contagious, but it could also be that they're the ones that don't want to get sick. Okay, airborne precautions. Says the patient's room must be private unless both patients have the same disease. So if you've got somebody in airborne, so TB, for example, unless they both have TB, they need to have a private room. It can have special ventilation equipment, and that's something that we always did in the emergency room at Children's. It was one group of rooms that had this negative air pressure, and so what they would do is instead of the air going back and circulating through the hospital, these particular rooms, actually the air was sucked out and into, like, outside the hospital. That makes sense? So instead of the air conditioner picking up that same air and recycling it through the whole hospital, it would vent out to the outside.
But wouldn't more people get it then?
Well, no, because then it's just going to disperse.
Oh, okay.
See what I'm saying?
Mm-hmm.
So, or not as likely anyway. The door of the room must remain closed. Obviously, staff and visitors must wear masks. If the staff has more direct, prolonged contact with the patient, it's advisable to wear gloves, gown, air covering, etc. Kind of depends on what you're doing. If you're going to be in there, if you're going to be giving them a bath, probably want to wear more than just the mask. Just because there's still like with TB, there's still bacteria involved. Even though we think, okay, you can only get it by breathing, well, there's still bacteria involved. So if you still get exposed to that bacteria, you can still get that. See what I'm saying? Or it could be a virus, but for that example. Patients should leave the room as little as possible and always wear a mask if they do. So droplet precautions, similar to airborne, but droplet travels no more than 3 feet. Therefore, the room should be private, again, or people have the same disease. They suffer different diseases, the same room, they need to be separated at least that 3 feet apart, which I would still want them to be separated, safer. Staff and visitors within 3 feet of them need to wear masks. And these can be regular masks. These can be like your standard mask, not the other ones. Again, wear a gown if you're going to be with them more, and then patients should leave the room as little as possible and wear a mask. Okay, contact precautions. Now, in my, contact precautions are the ones that you see most often, but as a nurse, contact precautions are the most cumbersome because there's more equipment that you have to put on. It's not just about wearing a mask. Okay, maybe private or have people with the same diseases together. Again, everyone entering the room must wear gloves and change them whenever they're soiled. Gowns, masks, goggles, hair covering should be worn depending on the length of contact and your activity. If I'm just going to go in and ask them a question, I'm just going to ask and be gone. But if I'm going to go in, if I'm going to draw blood, or if I'm going to do any kind of procedure, take their vital signs, I'll wear a gown and gloves. All must wash their hands and avoid touching objects before leaving the room. So anything in the room, when you have contact precautions, has to be considered contagious, or, well, infectious or contagious, or contaminated. There we go. That's the word I'm looking for. Everything in the room. So if I wash my hands, I go, tell them bye, I wash my hands, but then I touch the light switch, I'm going to have to wash my hands again as soon as I leave. Patients should leave the room as little as possible and avoid contact with other people or objects. Okay, a lot of these diseases that are contact precautions, that are in contact precautions, can live on non-living things. So on the desk, on their bed, whatever. And they have special, actually, equipment to clean it with. Very, very strong. You have to wear gloves when you clean with this stuff because it's, potent. Use biohazardous waste bags to dispose of any trash or items that are leaving the room. Equipment such as a thermometer, blood pressure equipment should remain in the room. So if you've got somebody who's on contact precautions, they need their own vital sign equipment in the room so that you don't have to bring stuff in and take it to the next patient's room and so forth. Stethoscope, everything. You don't even take your own stethoscope in. There will be one in there. Reverse isolation, the healthcare provider puts on any necessary equipment to prevent exposing the compromised patient to any microorganisms. And then it just depends on what their problem is. Okay, exposure. Should a known exposure occur to a microorganism, so HIV for example, then make sure that you always report it. Don't just pretend like it didn't happen, because it could affect you 20 years from then. And there are medications they can give you if you get exposed to something like this that will help prevent it from actually occurring. Incident report must be completed. Depending on the exposure, the area should be clean with antiseptic solution and blood tests completed. I've told y'all before about the lady, right, who did the intern who I held the baby for that lumbar puncture. We were talking about the other day. She poked herself. Everybody had to have blood work. She did, the baby did. Follow-up must be done as required by policies. Usually there will be some kind of policy as to what you have to do after that. Okay, so putting on personal protective equipment. Hands, you always wash them before you ever even get started, right? We wash hands before and after we use gloves and any of this other stuff. So the equipment is clean. It's not sterile unless you're specifically putting on sterile equipment like for surgery or something. But the equipment that you use just for regular precautions is not sterile. Like those gloves up there are not sterile. Sterile gloves come in a package, an individual package. We've looked at those before, right? Sterile gloving. Okay, order of application. You put on your gown, and then your cap, and then your mask, and last is your gloves. When you remove them, you guys know how to remove gloves. You don't want to ever touch the outside, any part of it that's contaminated. For your gown, you reach behind the gown and untie it. And then usually you only want to touch the inside of the gown. So when you take it off, you'll peel it off from here, and then you peel it off from up here, and you can just roll it all up inside of each other as you go. We'll look at it. We'll practice in a minute. In airborne, the mask should be removed just before leaving the room or outside the room. If they have one of those extra rooms like you were talking about, you can remove it out there. Hands should be washed again whenever you're finished. Make sure you place everything where it needs to go. When biohazardous containers are full, they should be removed from the patient's room through double bagging. And double bagging just means you're putting one bag into another and then tying it up. So we've got 2 bags worth of protection there. Okay, let's show you what I was talking about. Now some gowns are different. Some gowns just break apart. My goodness, come on. I don't think this kind does that. When I'm talking about taking them off inside out, so if I've got this gown on, usually there will be a tie up here. Somewhere, here it is. So I'd reach back and untie it. Once I untie it, it kind of comes forward, and I'd go from the inside here and pull it off this way. So I can pull my hands out from the inside, roll it up this way. Make sense? Turn it inside out.
Did you take your gloves off last?
No, usually what people will do with gowns is they take their gloves off like at the same time. Like, I know that's not really how it specifies it on there. Let me show you. so if I've got all this on, you want your gloves pulled over this too. These are not tied up at the bottom. Okay. Usually what you'll see people do, now I know it doesn't really specify this on there, is pull from here and here, and I'll just pull them, I turn them inside out this way, and pull them off as they go. Go from the inside here. Yeah, you get it. So, usually I'll take them off at the same time. The main thing is you just don't want to contaminate yourself. Now, whenever you guys go to nursing school, they'll have a very specific way they want you to do that and take it all off. So, obviously, stick with their way for their things, but that's how you'll usually see it. The most important thing is that you don't contaminate yourself or anything else. That you don't touch the outside of your gloves. You don't want to touch the front of your gown that's been exposed to anything. Those are the most important things.